Hello and welcome. I'm Nikki Valley, and today we're joined by esteemed podiatrist Dr. Dale Shrum, president of Advanced Foot and Ankle Specialist in Southern California. Today we're going to be talking about the importance of proper foot and ankle care for you and your family. Welcome, Dr. Shrum.
Welcome to the office.
Let's talk a little bit about your background.
Yes, I attended Long Beach State University, majored in chemistry. I then went to the California College of Podiatric Medicine based in San Francisco, California. I then attended LA County USC Medical Center where I did my residency, and then I started practice here in the desert.
So now that we know about your qualifications, let's talk a little bit about some of the most common problems that you do see in your practice.
Well, as a podiatrist, we see anything from the ankle as well as the foot, anywhere from fractured ankles, fractured feet, hammer toes, Taylor's bunions, nerve problems, skin conditions, and even bunions.
Now, I've heard a lot about bunions. How are they corrected? And what do you have to do? Is it a painful procedure?
Well, as far as correction, if you catch it at an earlier stage, we can do it conservatively. And that would do with stretching out your shoes, orthotics, inserts that fit into your shoes. But later on, we may have to do other procedures on it, and there's different ways that we can go. I personally perform over 30 different techniques involving the bunion surgery, and it depends on age, activity level, as well as a number of other factors that we look at.
Now, what would the procedure be if you were to perform something on someone my age, say, that would have a bunion?
Well, let's say you had an average type bunion with minimal arthritis in it. Usually what we would do is first take the bump off on the side. Now that's the easy part.
Is it painful?
In my office, it's usually not a problem. It's not an issue in the office as far as pain goes.
And is that a procedure where you're able to walk on it that same day, or does this take quite a bit of healing?
Under the condition we just spoke about, yes, you can walk on the same day. I had one lady last year. She text messaged me from a trail that she was hiking 4 weeks later after she had this technique performed on her. And usually it's not that much of a downtime.
We're speaking with Dr. Dale Shrum, president of Advanced Foot and Ankle Specialist in Southern California. We're going to take a quick break, but when we come back, Dr. Shrum will tell us about some advanced procedures that he's developed for the treatment of bunions. Stay with us.
Stop the pain. Are you suffering from foot or ankle problems? Bunions, sports injury, plantar fasciitis, just to name a few? Stop the suffering today. Dr. Shrum of Advanced Foot and Ankle Specialist provides the highest quality of care for you and your family. Get results now.
Hi, I'm Jan from Kitchen, and I've been in retail most of my whole life, so I've had a lot of problems with my feet, and I've been to a lot of different podiatrists over the year. And when I met Dr. Dale Shrum at Gold's Gym, I thought, you know, I'm going to go ahead and give him a try because he seems like he knows what he's doing. So I came into his office, and sure enough, he pinpointed my problem immediately, gave me orthotics. Immediately, I felt relief, and it was the first time in many years that I actually felt great on my feet.
Well, I'm a hairdresser, and I had something wrong with one of my feet, and I could not stand. And it was killing me, so I came to see him. He looked at my foot, he knew exactly what it was. He said he would have to cut it out, and I have no pain. He did a great job.
Call 760-674-3355. Your feet will thank you for it.
Welcome back. We're talking with Dr. Dale Shrum, president of Advanced Foot and Ankle Specialist in Southern California. And Dr. Shrum has developed several groundbreaking techniques for the treatment of bunions. Tell us a little bit about some of these techniques, doctor.
Here we can see the foot with a large bump with a bunion on the outside. The first thing we do is make an opening in the skin and take it down to this large bump, of which we will first remove it. Then we do a release of all the soft tissue in the capsule around the joint, as well as release the tendon which holds the toe in the inward position. We will reroute that at a later time in the procedure. We will make an osteotomy or a cut within the bone and then place it into a more proper position. There's a little extra bone. We will also remove that during the procedure, and then we'll put devices within the toe to hold it in a proper position while it heals properly, of which we reroute the tendon to hold everything in the right position. Here we'll be able to see the before and after views on x-ray as well as on a photograph.
Something like plantar fasciitis. I myself had problems with that several years back, and even getting out of bed in the morning, I was in a lot of pain. What is the best way to treat something like that? The quickest way to get somebody back on their feet, no pun intended?
Well, plantar fasciitis is heel spur syndrome, and a lot of people will see a huge spur on an x-ray and they think that that spur has to come out. That spur is actually developed from a ligament on the bottom of your foot, and it constantly pulls from the heel bone, and that's where the spur develops. As far as a quick fix, it depends on the person. Sometimes it takes us a little bit longer to get you where we want to get you. Other times it's very quick as far as physical therapy, anti-inflammatories, cortisone, and a number of other modalities that we could use. And this is a condition that you need to fix sooner than later. If you let it go for a longer period of time, it turns into a chronic condition, and those are the ones that lead to surgery.
Now, what about some of the more long-term treatment plans for this?
One of the treatment plans would be with an orthotic device, which is a custom-made device that fits into your shoe. We would take a mold of your foot after we do an evaluation. We check a number of the factors, if one leg is longer than the other, make sure that this is actually the problem that you have. We take a mold of your foot, send it to a laboratory. It's a prescription device. It lasts a number of years, and it works on a long-term basis for you. In this graphic that we have, we can see the side of the foot with the heel bone and a white ligament on the bottom. As we walk, this ligament will stretch because our foot is flattening. And you can see how the foot moves and pulls away from the heel bone. When that happens, it can partially tear or just inflame its area where it attaches to the heel bone, and this is where the plantar fasciitis occurs. The orthotic is intended to reduce that excessive motion. And a lot of people talk about pronation. Pronation is a motion in one direction. Supination is the opposite direction. Everyone pronates, or they should. That's part of shock absorption, as well as going to uneven terrain, like you're walking up hills or rocks. So you want to restructure your foot or change your foot. The orthotic will control that excessive motion or even eliminate the excessive motion, which creates the plantar fasciitis to begin with.
I've recently seen ads on TV about those insoles that you can buy in the drugstores. I've always been wondering, are those really effective?
Well, they can be effective a little bit, but it's just like going to New York. You can take a plane or you can take a bicycle. As far as the inserts you can have, they're just basically over-the-counter arch supports that just stick in your shoe, and they can help some of the excessive motion. But the orthotic device is the Rolls Royce. What it does is it controls that excess motion as well as distributes the weight evenly across your foot. An orthotic itself, there's a lot of prescriptions to it. We may add material to it, subtract material to it, do whatever is necessary to get your foot in the alignment that it should be working in.
And we'll be right back in a few minutes with Dr. Dale Shrum, President of Advanced Foot and Ankle Specialist in Southern California. And we're talking about how you can have happy and healthy feet for the rest of your life. Stay tuned.
Stop the pain. Are you suffering from foot or ankle problems? Bunions, sports injury, plantar fasciitis, just to name a few? Stop the suffering today. Viewed as one of the foremost authorities in podiatric medicine and surgery, Dr. Dale Shrum is double board certified and has several published procedures in the American Podiatric Medical Association's journal, the leading professional association for foot and ankle specialists.
I walk on the outside of my feet, and the second toe from the little toe started getting pushed under the foot like, and it was hurting me like to walk on. So I went in there and he looked at my foot. He said, well, he said, I think we can take care of this right now. He said, it's not going to hurt. I said, yeah, famous last words. But he did do it, and it didn't hurt.
I was out having a fun Friday night and was walking along and slipped on some slippery concrete wearing my 4-inch heels and landed just right to where I cracked the bone in my ankles. And a friend of mine referred me over to Dale, and I went and saw him the next day. He gave me a walking boot. It recovered quite nicely, and I'd recommend Dale to anybody.
Call 760-674-3355. Your feet will thank you for it.
Welcome back. I'm Nikki Valley, and I'm here with well-respected podiatrist Dr. Dale Shrum. And I'm glad that we're talking today. I wanted to mention this to you. I have a friend of mine who's been complaining of a constant pain that she's having. And she says it's in a very specific area between her third and her fourth toe. What comes to mind for you immediately when you hear that?
Something like that we want to look at if there's cramping of the toes, if there's electricity shocks. If that's what it is, it sounds like, without seeing your friend, a Morton's neuroma, which happens to be a trapped nerve in between the two toes there.
And it's pretty painful from what she says, and it sounds painful from how you
It can be, and
described
usually
it.
the more you walk on it, the more it aches, the more it's bothersome, the more of a problem it is.
So what would be the treatment for something like that for her? Would she have to go through an extensive therapy for that, or is there something that might be a little more short-term of a solution?
Well, the first thing we'd have to do is an evaluation and to properly diagnose it. And there's a number of techniques that we would do. First, clinically, to see if that's the main area, to see if there's separation of the toes, see if the pain is in that area, if we can feel something between the metatarsal bones is where it usually lies. We take an x-ray to make sure it's not a fracture or abnormal growth, anywhere in that lines, as well as to evaluate the joints and the structures in the foot.
We may use a diagnostic ultrasound to view the deep structures inside the foot. Here we're using the SIUI CTS 5500, which is one of the top machines in the world. It gives us a very clear view of all the structures inside the foot, as well as pathology that may lie deep inside the foot, and it gives us a very clear image, as you can see here on the screen.
Now, doctor, I understand that the problem of flat feet is pretty common amongst athletes. Is this something that's easily treated?
Well, let's first talk about flat feet. Generally speaking, everyone is born with a flat foot.
Oh.
And as the children start to walk, their arch develops, and by age of 7, they should have a normal type of foot.
Okay.
In our example that I have here as our models, you can see here, this is a normal arched foot. You have a little bit arch through the inside portion of it. But when you look at a flat foot, you can see how it's completely depressed and downward. Now, when you do have a flat foot, a lot of things can happen from there. But usually with athletes, we see a tendon problem on the inside, the plantar fasciitis we talked about, the heel spur syndrome. Sometimes a neuroma can even create that, but that's generally what we see with athletes. As far as treating it, it depends on the extensive nature of that condition. Sometimes we have to put them into a cast. Sometimes it requires surgery or other type of investigative work like MRIs, etc.
And you mentioned that we're all born with flat feet. So do you treat a lot of children in the office for that problem?
Well, yes, generally we're all born with flat feet, and it depends on the extensive nature of the flat foot condition. If it is extremely flat foot, we can put a certain type of orthotic device, which is specifically made for that, to help them sustain an arch and grow into a proper arch.
Now, with all of your experience and your qualifications, you seem well equipped to be able to handle any kind of foot problem that someone would come in with. What type of advice would you give to people who are looking for preventative care and ways to really keep their feet healthy before a problem develops?
First of all, proper hygiene is important. Make sure that there's no type of problems within. If they're a diabetic, taking care of the sugar complement of it. Proper fitting shoe gear is also important. And just stretching exercises and just looking at their foot in general.
Dr. Shrum, thank you for being with us today. You've been a wealth of invaluable information about proper foot and ankle care.
Thank you for the opportunity to share this information with you.
You're welcome. And for more information, you can go to drshrum.com or call the number that you see on your screen. Now, your feet have taken you to the most memorable places of your life. Shouldn't you treat them well?
Stop the pain. Are you suffering from foot or ankle problems? Bunions, sports injury, plantar fasciitis, just to name a few? Stop the suffering today. Dr. Shrum of Advanced Foot and Ankle Specialists provides the highest quality of care for you and your family. Get results now.
I would recommend Dr. Dale Shrum to anybody who has any kind of problems with their feet or ankles. He's helped me so much over the years. He's so great. I've even brought all 3 of my sons here, and he's actually really great with kids too.
I have recommended Dr. Shrum to several of my friends because he's a good doctor. He's easy to be with. He's easy to talk to.
I'd recommend Dale to anybody.
Call 760-674-3355. Your feet will thank you for it.